Childhood obesity remains to be a nationwide problem in the United States. There are various types of health effects of childhood obesity. In an episode of The Simpsons, the son, Bart Simpson, states, "When I grow up, I'm going to be a lardo and workman's comp, just like Dad," which reflects patterns of obesity. In reality, many obese children will become an obese adult or suffer from other medical health issues later in their adult life unless action is taken properly. Experts state that the current generation of children will pass before their parents because of the harmful effects that are associated with this health concern. There are two types of health effects of childhood obesity: immediate effects and long-term effects. The immediate health effects are detected in young obese children. According to the article Health Effects of Childhood Obesity, written by the Centers of Disease Control and Prevention experts, states that the children are more likely to have health effects of cardiovascular disease such as high blood pressure and high cholesterol. These health effects are usually detected in adults. However, due to the increasing rates of childhood obesity today, these effects are becoming more common in obese children. According to the experts of the Centers for Disease Control and Prevention, they state in a population-based sample of 5 to 17-year-olds, 70% of obese youth have at least one risk factor for cardiovascular disease. Prediabetes is another health effect that is starting to be found more often in obese adolescents and which can later develop into diabetes. According to the authors of the article, short and long-term beneficial effects of a combined dietary, behavioral, physical activity intervention for the treatment of childhood obesity, the authors state obese children tend to become obese adults. A study experimented by the Centers of Disease Control and Prevention found that obese children as young as 2 were more likely to become an obese adult. Therefore, long-term effects are likely to begin in obese children and stay with him or her throughout adulthood. Due to this factor, this leads to more health concerns such as type 2 diabetes, stroke, heart disease, and various types of cancer. The author of the article, Lifelong Effects of Childhood Obesity, interviews Dr. Kirsten Bibbins-Domingo, an author of one of the New England Journal of Medicine studies, and her colleagues on childhood obesity. Bibbins-Domingo and her colleagues have researched childhood obesity rates from the year 2000 and have predicted by the year 2020 that 44% of American women and 37% of men at the age of 35 will be obese. Dr. Bibbins-Domingo states, "We found, not unexpectedly, that the prevalence of heart disease will rise by as much as 16% and heart disease deaths by as much as 19% between the ages of 35 and 50 years. From Bibbins-Domingo's research, the article estimates there will be about 100,000 more heart disease deaths among 35 to 50-year-olds due to obesity." For more information on the immediate and long-term health effects of childhood obesity, please visit www.cdc.gov.